Earlier today, I was informed that I have been in close contact with someone who has tested positive for COVID-19. And so as a result, I've been tested myself and I am awaiting for those results. But regardless of whether the results are positive or negative, I will, of course, observe Alberta Health guidelines by staying in self-isolation for 14 days from the close contact, which was on Monday. And that means I'll be in self-isolation working from home until November 23rd. Today, I want to update you on COVID-19 in the province and announce a new series of targeted measures to protect the health system and limit the spread. First, I want to put our current state into context. In the spring, our highest daily new case count at the peak was 351. The highest number of hospitalizations we had in the spring was 88, with 21 people in intensive care. Our current state is twice as high as those numbers, both in terms of new cases and hospital impacts as the numbers continue to grow. It's almost certain that we've not yet seen the peak of the current increase. Yesterday, we identified 860 new cases of COVID-19 in Alberta on over 15,000 tests. There are now 225 COVID-19 positive patients in hospital, 51 of whom are in ICU. There are 16 hospital outbreaks with active cases right now affecting 9 healthcare facilities around the province. The Edmonton zone has already had to postpone about 30% of elective surgeries as a result. Our rising community spread is putting our healthcare system under real stress. It's not just our hospitals that are being impacted. We were deeply grieved in the spring by reports of a continuing care outbreak that caused over 100 cases and 20 or more deaths. Right now, we have more than 50 active continuing care outbreaks, 3 of which have over 100 cases each. Operators and workers are trying their best to contain the spread and continue providing care, but the numbers are very troubling. The total number of active COVID cases in continuing care across the province more than quadrupled from less than 100 on the 1st of October to over 400 at the beginning of this month. The number of exposures at school also rises as spread increases across the broader community. And while the work of students, parents, staff, and teachers has been fantastic to prevent onward spread, there is an ongoing challenge as the numbers rise throughout the broader province. And we are at a dangerous juncture in our province. These numbers I've just shared add up to one unavoidable fact. The growing number of hospitalizations, ICU admissions, are challenging our ability to continue delivering non-urgent health services that Albertans depend on. And this, of course, affects everyone. It's not just an Edmonton problem or a Calgary problem. Currently, there are 55 communities in the enhanced measures status. While cases are rising fastest in our 2 largest cities, we're also seeing increases in many other towns and cities. The impact of the measures I announced on November 6th are only just starting to be seen, but we can't afford to wait. COVID-19 is challenging us, and we have to rise to this test. We have to bend the curve back down to support our healthcare system, to protect vulnerable Albertans, to keep schools open, and to avoid further damage to people's livelihoods and the economy at a time of great adversity. We've seen examples in some U.S. states, European countries, Quebec, and elsewhere of the impact that COVID can have when it overwhelms the health system. We must not let that happen in Alberta. Today, I'm announcing a series of targeted measures for the province that were decided on yesterday by the Priorities Implementation Committee of Alberta's Cabinet, based on the advice of the Chief Medical Officer for Health. They're intended to act as temporary, time-limited measures to help protect the health system and reduce the spread of COVID-19. These measures collectively are meant to reduce the number of close contacts that Albertans have with others in the weeks to come, to try aggressively to bring our numbers down. Some of these measures are specifically time-limited for the 2 weeks from November 13th to the 27th. The first and most geographically targeted of these measures is that starting tomorrow, we're implementing a temporary stop to all group fitness, team sports, and group performance activities in urban centers where spread is rising. This will apply to all such activities in Edmonton and surrounding areas, as well as Calgary and surrounding areas, plus Grand Prairie, Lethbridge, Fort McMurray, and Red Deer. Many fitness operators and sport organizations have done great work to make their facilities and activities safe, and I thank them for their effort. This 2-week pause reflects the fact that at this moment in the province, we need a pause on any activity that has a significant chance of spreading infection from one to many. COVID-19 is spread by close contact with respiratory droplets from someone who's infected. Group sports and fitness classes can cause a high risk of spread due to exertion where participants have a high rate of droplet emissions in enclosed spaces. Socializing may also take place before or after the activity, which we've seen as a factor in recent team sports outbreaks. We've seen several large outbreaks linked to group fitness or team sports in the past few months. To be clear, this 2-week activity stop applies to all indoor group fitness and sports. It does not include outdoor sport, individual sports like tennis, individual exercises, training, or equipment use. And it also does not apply to junior, university, or professional sports, as they have additional public health measures in place to limit the risk of exposure. Despite this pause in team sport and group fitness activities, I want to underline the importance of regular physical activity in both physical and mental health. I encourage everyone who participates in these activities and who's impacted by temporary measures to remain active during this time. Group fitness may be able to move to virtual delivery for this short time, and there may be options for winter outdoor sports. Similarly, the temporary stop on group performances is only in the cities and surrounding areas that I mentioned earlier. The group performances limits include group singing, dancing, and theater cohort groups. Although we have not seen significant spread from these activities, we know that when done in closed space with people in close contact, they can also cause spread of the virus from one to many. Like many sports organizers and fitness center operators, many theater, choir, and dance groups have done excellent work to keep their members safe. This 2-week pause is part of the temporary time-limited measures, and these activities will be able to resume soon. I know that these activities are also an important part of Albertans' mental and physical health, and I encourage participants to find ways to practice individually in the 2-week pause. The performance restriction does not apply to professional performance venues, as they also have additional public health measures in place. The second measure is more geographically widespread. Beginning tomorrow, all restaurants, bars, lounges, and pubs in areas that are under enhanced status with more than 50 active cases per 100,000 people must stop liquor sales by 10 p.m. and close by 11. I know that operators have worked hard to follow the guidance in place and protect their patrons. I thank them for their dedication and for their commitment to keeping their customers as safe as possible. But extended drinking and socializing in these settings, which primarily occurs very late at night, poses a risk for spreading COVID-19. Limiting the hours of liquor consumption and operating hours will allow these businesses to stay open most of the time. And let me stress that the vast majority of restaurants and businesses in the hospitality sector have shown great care and responsibility over these past tough months with very limited spread. Unfortunately, we've seen a growing number of violations where bars and pubs in particular have turned into virtual nightclubs. And I'll remind you that nightclubs are one of the few business activities that have been suspended since March for obvious reasons. And it's these growing number of violations that have created the concern and caused today's restriction. While helping limit the times where social mingling combined with alcohol consumption is most likely to occur, similar restrictions are currently in place in most other provinces. Thirdly, we are strongly recommending that Albertans living in any area under enhanced measures on our relaunch map not have social gatherings in their homes. Now, as you know, we made that call last week for Calgary and Edmonton, and we are now expanding that to all areas that are under enhanced measures, this must be taken seriously. We are putting our faith in the good judgment of Albertans, which is why these measures are voluntary right now. No one wants to have a government tell us how many people we can have in our homes. But the alternative to voluntary action by Albertans is mandatory restrictions, like in most other places, backed by fines. And if we continue to see large private parties that ignore these recommendations, we may have to consider enforcement action. 40% of the spread of COVID-19 can be traced to transmission at home and at social gatherings. I don't think it's unreasonable for people to suspend these kinds of gatherings for the time being, a measure that can turn the numbers around, help to protect the healthcare system without impairing businesses or jobs. If this one source of spread was to stop, we'd be in overwhelmingly better shape almost immediately. I'll just give you one example. I was talking to a friend, a business owner last night, who said that they've taken great care to follow all of the protocols. They've had all of their workers back at the workplace, no COVID spread, checking for symptoms every day, use of masks and hand sanitizers and barriers and spacing at work. So a model performance by this employer, but one of the employees who had been out at a poker night got COVID positive. Somebody who thought, they were just relaxed with some old friends at home, probably sharing some drinks and some laughs in close quarters, probably sharing the same snack bowls and everything else, got COVID positive at a poker game at someone's house and brought it to the workplace. That's how this is spreading in large part. And that's why we're asking Albertans to take this seriously. If you're an Albertan living in an area that's under enhanced precautions, you should not be going to should not be going to gatherings in other communities that don't have restrictions. That increases the risk of spread and puts even more people at risk. The social gathering limits applicable to the area you live in are the limits that you should follow everywhere. In addition to these limitations, we are implementing several other measures for all regions under enhanced status. And starting tomorrow, there's a 50-person limit on wedding or funeral ceremonies in all of these areas. We recognize the importance of these activities, the lifetime importance of them, and the challenge that this limit presents. But we've also seen a number of large outbreaks linked to weddings and funerals, given the proximity that happens, the intimacy of these events. And we need to take additional measures with community spread rising sharply. These events are inherently emotional, as I say, and they bring people together. It's challenging to limit close contact between attendees at these events. This mandatory 50-person limit will help to limit exposure at wedding and funeral ceremonies, reducing outbreaks, and protecting the vulnerable members who do attend. We're also asking that all faith-based organizations in enhanced areas limit the attendance at any worship or faith services to 1/3 of the room's capacity. And I want to thank all the faith leaders and communities that have worked so hard to limit the spread of COVID since it began. These groups have done amazing work in protecting their members and their communities. And I was talking to some faith community leaders about these potential restrictions, and they told me that because of the social distancing guidelines, they're all operating at less than 1/3 capacity at their places of worship already. The problem is not the vast majority of these communities. The problem is a small number who have been disregarding, in some cases flagrantly disregarding, the public health guidelines on worship services. And we have seen some spread coming from such communities. And so this is a call to them to take this seriously and limit capacity, or limit the gatherings to 1/3 of capacity.